Initially, I was just taking a few medicines, but the fever did not go down. I had lost my appetite, lost a lot of weight, and despite all the treatment, when it did not work out, I was told it would take 2 years now, and the tablets were doubled. So I was taking around 20 tablets every day for 2 years and injections for more than 6 to 8 months.
Saurabh was only 22 years old when he was diagnosed to have tuberculosis. He was on tuberculosis medicines for 6 months, but a couple of months later he suffered a bad relapse of the infection. He was diagnosed with extremely drug-resistant tuberculosis. Tuberculosis is one of the top 10 causes of death worldwide, and India has the maximum number of cases of this deadly but curable and treatable disease.
The WHO organization's Global Tuberculosis Report in 2016 estimates that there are 79,000 cases of MDR or multi-drug resistant TB in India.
Now, an active case of tuberculosis usually can be treated with a standard 6-month course of 4 anti-TB drugs. But now, over the years, new forms of TB that are resistant to the standard drugs are being seen.
This is a serious problem and a big public health issue. So today we will look into what are the different forms of this drug-resistant tuberculosis and what factors can lead to it. Welcome to Doctors on Call. I am Dr. Sonia Lal Gupta.
And I am Dr. Sameer Gupta.
Tuberculosis is a disease caused by the bacteria Mycobacterium tuberculosis. It is spread from person to person through the air. When a person develops active TB disease, symptoms such as cough, fever, night sweats, and weight loss can be mild for many months. It usually affects the lungs but can also spread to the other organs of the body. In the recent years, new forms of the bacteria have come up, causing different forms of drug-resistant TB. Multi-drug resistant TB or MDR TB shows a resistance to the most effective anti-tuberculosis used drugs, isoniazid and rifampicin. The extensively drug-resistant TB or XDR TB is a more severe form of the MDR TB, which is additionally resistant to the second-line drugs that includes at least one of the 3 injectable anti-TB drugs. And the extremely drug-resistant TB or the XXDR TB that shows resistance to all the 12 drugs, making it virtually untreatable.
Now, in the case of Saurabh, he had an extremely drug-resistant form of TB that led to further problems during his treatment.
There's a lot of stigma around TB is you don't go outside and talk to people, so there is no mental support. You can't go out and talk to anyone, you can't tell anyone. Since you're not well, you're sitting in your own house. So, it's not just the physical problems that you go through, it's also the mental problems. And physical problems also, it's not only the tablets, it's the side effects of the tablets that you have to face. Right from being partially blind to losing, partial hearing, touch, sensation, developing thyroid problems, jaundice. Unfortunately, in my case, I had to go through everything. So, in terms of treatment, first thing you need to make sure that you're on the right treatment. Because most of the times, TB cases go misdiagnosed or undiagnosed. What you need to do is you need to push for a drug sensitivity test. Something that I was pushing my doctor the first time I got diagnosed. Fortunately for me, I came from the medical background, so I kept telling my doctor that we should get this test done. What this test does is that it shows you out of the number of drugs that are present to treat TB, how many of the drugs are resistant in your case. That means they will not work on you and you might have to use other drugs. Sometimes it's way too late, like in my case, by the time we got to know, it was a long time gone. So when I got diagnosed, I was told by my doctors that maybe I wouldn't really have the same life I had before. I couldn't maybe go running or play sports because during this entire treatment I actually lost the lower half of my lungs. For whatever reasons it happened, but I have to live with it for the rest of my life. So what was considered to be impossible, like running and playing, I actually started doing that. And that in itself is something that doesn't happen normally. So what I realized was nothing is impossible and you can actually get through everything. And having an experience like this gives you a boost. So whatever I am today, I treat it as a gift because today I wasn't really supposed to be alive with what I went through, but I am.
Now, various reasons lead to the drug-resistant form of TB. First, delay in detection and treatment. Because of limited availability of good diagnostic services, there is often a delay in getting drug sensitivity test, as was in the case of Saurabh. Number 2. Adherence to treatment regimens. Tuberculosis treatment is usually at least 6 months. Sometimes, patients find it difficult to complete the entire course of the TB drugs and leave the medicines midway. This promotes resistance. Expensive drug regimens. Multi-drug resistant or MDR TB drugs can cost more than 1 to 1.5 lakhs, and the cost of extremely drug-resistant TB is even higher. This often deters patients from completing the entire treatment.
The WHO has developed newly adopted sustainable goals for ending the tuberculosis epidemic by 2030.
Early diagnosis is key in helping curb the spread of TB. If for any reason your symptoms of TB persist despite having the standard treatment, speak to your doctor about drug sensitivity testing. That's all for now. See you next week. Saurabh was lucky to have overcome the illness despite all the difficulties and in spite of having a decreased lung capacity. He has run multiple marathons and has recently completed a difficult Himalayan trek. He has also set up an NGO, Survivors Against TB.
If you ever need support, like I said, we have formed a group called Survivors Against TB. You should come and talk to us. We are there to support you and guide you in any way we can. At the same time, make sure you're looking after yourself. Take your medicines on time. Make sure you're eating right. Make sure you're monitoring your side effects, your weight. Keep on talking to your doctor more and more often. And remember one fact, that anyone who comes and tells you, you should be happy that you're just alive, that's not the case. Once you're out of TB, even when you're on TB, you can actually live the life you want. There's no stopping it.